On this week's Case of the Week, we have a doctor who sent in a case for a 3-unit BruxZir Bridge, and we needed a new impression, and this is actually the new impression that we got. So it's a full arch, double arch tray, and that of course is the opposing arch, and here is the prepped arch, and you can see something interesting here. It appears that there was just one impression material originally used, this light green material, and then a darker green material was used, which does not extend all the way around the impression, which it would have had it been used in a simultaneous technique. And then there's this third inner layer, this orange layer, that's peeling away from the dark green layer, mainly because these two materials did not set up at the same time. It kind of reminds me, just looking at it, of like a Joe Masad denture technique, where you use 3 different viscosities of material on the edentulous ridge. But even in that technique, you use all 3 of these at the same time, so all these materials set up together. When they set up differently, there's nothing that really causes this inner layer material to bond to this outer one. And then any time that you do multiple layers where you're just adding in one spot, you end up with a double and or a triple impression here, where you don't have an accurate relationship between the impression on this side of the bridge and over on this side, where the other teeth have not been relined with that same thickness of material. So this is the new impression we got from the doctor, and called the doctor, and the instructions from the doctor were to do our best. And that's going to be difficult in a case like this. In fact, if we look at the preparation before, you can see where we have some draw issues on number 12 and number 13 and for this 3-unit bridge that we have here. And so that's why the request was made for the new impression. In fact, they did pour up that new impression, and we got a model back, and because we were instructed to try our best, a 3-unit bridge has been fabricated for this case and will be sent out to the doctor. You know, we kind of fully expect that this is going to be a remake on this case, and that another impression is going to need to be taken to be able to get this restoration right. You know, but when the doctor, you know, we're working at the prescription of the doctor. When the doctor tells us, go for it and see if you can make it work, and if it doesn't work, I'll take another impression. You know, we're going to send a restoration out if that's what they ask for. Of course, my recommendation for this doctor or any other doctor is, if it doesn't work on the first try, certainly just start over again. I know you're going to have to waste one of these disposable trays and throw it out. But we're pretty certain that if you have to reline something once or even twice with 2 different layers of polyvinyl siloxane, that whatever resultant impression we get is not going to work. And so why, you know, unless you're just trying to get the patient out of your office that day, why put the patient through this for a restoration that we're 99.9% sure is not going to accurately fit? And so maybe it's an issue with bleeding, or maybe it's an issue with tissue retraction, but relining an impression for a second and third time never is the answer to get an accurate impression.